I had a motorcycle accident where I broke my back, lots of damage in 2007. Nothing could be done. I just carried on through life with pain, seeing the occasional chiropractor, which helped, until I thought there's nothing else that can be done. And I heard about the Acorn Centre with a bit of acupuncture. I was more interested in the acupuncture, that being the only thing I haven't tried. So I came along to Acorn, and I've had loads of different treatment, from acupuncture to chiropractic, manipulation, hypopressives, and over the period of a couple of months, I have gone down to around 80% of the pain gone. I'm just absolutely amazed. I just can't praise them enough. I actually feel that I've got my life back. I was in the state of actually thinking, there's nothing I can do. I'm going to live through this pain for the rest of my life. I need to end it. But this has just given me a whole lease of life. It's perfect. Just love coming here. Brilliant, thank you.
When I first met Malcolm, he was in quite a lot of pain and had been so for some time following his motorbike accident. When it comes to dealing with people with chronic back pain and really trying to help to get them better, we have to offer a package of care. That's what all the research and the evidence base shows to be most effective. And what I also knew from talking with Malcolm when he came in was that he'd had chiropractic treatment before, he'd found it beneficial, but he hadn't seen lasting results from it. So I knew I had to do something different. As a chiropractor, we are trained to use lots of different techniques depending on the patient in front of us. So when Malcolm came to see me, as part of his treatment plan, we talked about it and we decided that we would use chiropractic adjustments, we would use acupuncture or dry needling on his muscles to help release tension, and we would also try teaching him the hypopressives method. So as part of his treatment with me, we incorporated all of those, so I saw him for slightly longer appointments each time. We would do the adjustments on his spine, we would do some dry needling, and then we would proceed where he and I would do some one-on-one hypopressives instruction. As part of our treatment at Acorn Health, we collect what are called patient-reported outcome measures. And again, this is something else that is proven to be best practice. It's how we know that the work that I'm doing for you and the work that we're doing together is effective. So it gives you an opportunity to feed back to me and let me know how you were when you first came in and how you are now, and also any feedback on the treatment or the service that we've provided to you. And with Malcolm, I was so delighted not only to get his fantastic feedback that he's given me today, but also to see from his care response that he has seen such a significant improvement in what he thought was going to be a back pain problem that he would live with for the rest of his life. So we have talked about it because obviously he's had significant injuries to his back, so he knows that he'll always have to look after it. But that's again where we're able to help him in what's called supportive self-management. So he has advice, exercises, things that he can do at home, and periodic treatment with me, which will help maintain his problem at a level that he is able to cope with. And as you can see from his feedback, he feels he's got his life back, which is just wonderful to hear as a chiropractor.